Hello, my name is Cynthia Owens, and today I will be doing the postoperative breathing exercise and some mobility exercises teaching as well. And today is March 21st, 2021. And so the first thing that I would do is I would enter into a patient's room after I've gotten permission to come in, usually by knocking or something like that. If they're not able to respond, then I would still knock just to let someone know that I'm there, and then enter the room. Once I enter the room, then I would introduce myself. Hello, Mr. Jones. My name is Cynthia, and I will be your nurse today. And then I would perform hand hygiene. And then once I have the hand hygiene completed, then I would go over to the patient and I would verify the patient with at least 2 identifiers. You can do more, but not less than 2. So that more commonly is their first and last name, and date of birth. Those are 2 questions that usually everyone knows the answer to. So ask their name. Okay. All right, Mr. Jones, your date of birth? Okay. All right. So once I confirm that, and I've checked it in tomorrow that I know that I'm in the correct room and talking to the correct patient, then I would proceed on with the deep breathing exercises. So the first one that I would teach Mr. Jones is the one for diaphragmatic breathing. And for diaphragmatic breathing, basically it's your diaphragm, which is here, and you can put your fingers together like this, and then you'll get into that area of your diaphragm. And when I would let Mr. Jones know that when you're doing the diaphragmatic breathing, you want to make sure that you're not, using your shoulders, like, breathing like that with your shoulders. You're not using your ribs or accessory muscles, while you're breathing, but just breathe from your stomach or your diaphragm alone. And basically when you do that, it allows, proper ventilation of air. We want to have you of course, breathing, but we want to make sure that the air is getting through. So what we'll do is that if what I'm going to have you do is take 10 slow, deep breaths, just to get ventilation going. And also that helps too, because if there's some sediment in there or something like that, you want to get that moving too, because you don't want that to sit, and then that's where infection starts to breed. The other thing is that diaphragmatic breathing is important, is you don't have to stick to like a hard, fast 5 minutes. We're not looking for that. What we want is at least 10 slow, deep breaths. And like I said, that gets, and do that every hour while you're awake, because that gets air moving, within your lungs. And it's important for you to do that, especially until you're mobile, because that will help to get you to breathe out that anesthesia that you've had during surgery. And it will also help to prevent blood clots, especially in your lung area. We don't want any blood clots in your lungs, and we certainly don't want those to break off and go, to your brain and cause a stroke. So it's very important to do the diaphragmatic breathing. Okay. All right. So Mr. Jones, do you have any questions for me? Okay. All right, good. So the next thing that I would have you do is, it's called an incentive spirometer. So basically it's a box with a tube that you blow into, and it will measure how much capacity of air that you can hold in your lungs. Normal range is about 6 liters. But again, depending on your health condition, how invasive surgery was, how much anesthesia you've had, that number can vary, but at least it gives you a number and a target to shoot for. Now, your physician may give a certain number that they want as a goal to be set, but we'll just set it, keep it at the 6, as he said, and then if it needs adjusting, then he'll do that. But you're going to do the incentive spirometer. You're going to take in a deep breath as much as you can, put your lips on the tube, and then blow out. And then you should see that needle go up, as you're breathing out. So you're going to do that for about every hour while you are awake. So it's important, like I said, to keep that, because that keeps the ventilation going. It also prevents, any blood clots or embolisms, which is clots in the lungs. It helps to prevent that, from happening. And it just, like I said, keeps your lungs free and active. And usually a good reading for this is about 80%, depending, like I said, on your condition, or 6 liters. So, and that's what we're trying to shoot for, especially for patients like yourself that just came out of surgery. All right. So did you have any questions for me or any concerns concerning either the diaphragmatic breathing or the intensive spirometer? Okay. All right, good. So another breathing technique that we would teach Mr. Jones is called the huff cough technique. So Mr. Jones, what I'm going to have you do is, if you can sit up in the bed for me, let your feet hang over the side. So I would definitely assist Mr. Jones in doing that, because he did just recently come out of surgery. I certainly don't want him falling out of the bed. Before I do that, I would definitely make sure that the bed is in the lowest position in case there's some stumble or accident, but we hope not. So anyway, I would have him sit straight with his chin tilted slightly and his mouth open, like that or something. And I would have him take a slow, deep breath in to fill his lungs, probably more so about a quarter of a way. And then, so Mr. Jones, what I'm going to have you do is to suck in the air with your lips like this, so that you can suck in the air. And then when you suck in the air that way, and if we had a nose pincher, we could pinch his nose. But when you suck in that air that way, you're using more of your diaphragmatic breathing to do that. So I'm going to have you suck in air, and then you're going to hold it for about 2 or 3 seconds, and then forcefully but slowly blow it out. So it'd be like this in one motion. And then when you blow it out, it kind of makes that sound. So you're going to do that for a cycle of maybe 4 or 5 coughs, and that helps with airway clearance. So that's, if you have anything in your lungs, that's going to cause it to come up. So if you do cough like that and something comes up, you want to make sure that you look at the color, make sure that it's not like yellow or green, because usually those colors is an indication of infection. And also, if you smell any strong odor or any bad odor from what you cough up, that's usually an indication of infection too. And we want to make sure that we keep that under control, and that we give you medicines like antibiotics to alleviate that infection, because we don't want it to get worse and worse. Okay. And so, like I said, you're going to take in the breath, and I'm going to have you do it. So what I just taught you, I want you to do it back so that I know that you understand, or if you have any questions. Okay? Okay, good job, Mr. Jones. All right. So able to do the huffing cough, and that's great. And there's also another one that's called controlled breathing. And so what that does is it's a controlled coughing technique as well. So you would take in 2 slow breaths, 2 slow deep breaths actually, and inhale through your nose and exhale through your mouth. So, and then so you're going to do that, and of course you're going to stay on the edge of your bed with your feet to the floor and lean a little forward, just so that you're relaxed. So you're going to breathe in slowly. I'm going to demonstrate it one more time so you can see exactly what I'm doing. And then I'm going to have you do it back, okay? All right. So I'm going to breathe in through my nose and then exhale through my mouth, okay? All right. And so while you're doing that, you would cough. I don't want to cough on you. So, so anyway, so you would do that about 2 or 3 times. And as you exhale, with your mouth is slightly open. So you're not just like, breathing out. So I'm going to have you teach it back to me. Okay. All right. Go ahead, Mr. Jones. Okay. Good job. All right. So, the other thing that I'm going to have you do too, which is very important, is that you do exercises in bed until you can get out and actually physically walk around. So again, what this helps with is to make sure that you're not getting blood clots, that you keep your circulation, because the thing is with blood clots, they can break off and travel to your heart, they can travel to your lungs, they can travel to your brain, and we want to do all that we can to prevent that. So, so one of the things is that we want to make sure that you don't lay in one place for too long. And what that will help do is to decrease like any pressure ulcers, or sometimes people call them bed sores. So a lot of times if you're laying too long, especially like on bony areas like on your hips or the balls of your heels or your coccyx area, like that lower part of your back, that's near, your behind your buttocks, then, that those areas are very prone to bed sores. So, because when you get bed sores, it's really cutting off that circulation, to those areas, because a lot of weight and pressure are on those areas. So we want to definitely prevent that. So what I have you do is to lie on your back. You're going to fully lie down and move towards your left side. You should be this way. And then bend your knees and press your heels into the mattress, and then, like raise up on your behind area and then move to the left. So you can move that way. You can move up by doing that. Or you can be laying flat and use your heels to push yourself up in the bed, if you need to kind of reposition yourself. And if, I need to move you or another person needs to move you, you can always roll, grab onto the bed rail and then pull so that, you can kind of be in that turning motion so that you can, roll. The other thing is, if you're rolling the other way, it's just opposite leg. So you would use your left leg and roll, or your right leg and roll, whichever. And to, as far as repositioning you, that will help us, because then we don't have to, move completely all of your weight. So that would be more so. But as far as, and then this wouldn't be for Mr. Jones, this is just for you. But for a dying patient, a lot of times they are left lateral or either supine, which is, on their back. But at that point, it's just whatever is the most comfortable, that they want to lay. Depending on the resuscitation orders, you may want to put them in a position where if they are starting to die, that you can take resuscitative interventions the easiest. Like you may not want them on their, laying prone and they're on their face, and then you got to turn them over, you got to do all this, to resuscitate them. So, most comfortable for the patient, but also best access for you. For stroke patients, it's best that if they're elevated, like in the semi-Fowler's position, what that does is that it creates less pressure, especially intracranial pressure. It creates less pressure, so it's less stress, on the neck, on the back, on the brain, and things like that. So the other thing, Mr. Jones, that we would have you do is leg exercises. Those are very important, and you can do those like 5 to 10 times, each hour while you're awake, and that will keep your blood flowing so that you don't get blood clots. And also it keeps, your muscles, limber and everything like that, so that you don't have muscle weakness or muscle wasting, depending on what, the condition is. So what I would have you do is to extend or flex your foot. So you can do it back, forward, back, forward. You would do these about 5 times each every hour.